Discs don't actually slip, but what can happen is they bulge out and that can cause pain, especially if it touches on a nerve. Let me explain. So the spinal discs are the shock absorbers between the bones, between the vertebrae, and they're made of two substances. So you've got the outer layer of cartilage like that, called the annulus, and then you've got the nucleus, which is basically like a jelly substance. And if it's healthy and intact, then the jelly stays inside. But what can happen is that over time, through like old injuries or bad mechanics, which I'm going to talk about in a second, this outer layer of cartilage gets damaged and frays like this. And then if that happens enough, especially on one side, what happens is the jelly can leak out. It bulges out like this. So that's technically a slip disc. So the disc itself hasn't moved, but the stuff on the inside is bulged out. Now, sometimes that can happen without you even realizing it, because it doesn't always cause pain, but it can do, especially if it touches on a nerve. Because remember, the nerves come out between the bones at just behind where the disc is, which means that if that's bulging against the nerve or causing inflammation that's compressing or irritating the nerve, you're going to get pain where that nerve goes. The most common example of that's sciatica, of course, so pain all the way down the back of the leg because it's compressing one of the nerves that makes up the sciatic nerve. So why does this happen? Why does it wear out? Well, first of all, you can't just blame it on age because it's often called wear and tear, but you can't just blame it on age because if you look at an x-ray of someone's spine, usually what you'll find is that several of the levels look different. Some of them look older than others. And the reason for that is that the ones that look older stopped moving correctly. They either got seized up and jammed up and weren't moving, or there was an old injury to that area or something that stopped it from functioning. The ones that keep moving the way they're meant to stay young and healthy. So it could be old injuries, and it doesn't have to be a major injury. It can be the result of just twisting in the garden or bending or something like that, where you tweak your back, and a few days later, a couple of weeks later, it feels better, but now you're left with some of the moving parts aren't moving the way they're meant to. Then fast forward over 10 years, and that's putting the wrong kind of stress on the discs, and that can cause a slip disc. But sometimes it's more obvious, like having one leg longer than the other, for example, which is really common, but most people don't know about it until it starts causing a problem, like wear and tear in one hip or a slip disc or something like that. This is the kind of thing that we always look for when people come in. And it can be stuff that you're doing day in, day out. So carrying a bag on the same shoulder, for decades at a time, or sitting in a certain slump position at work. So you're putting more pressure on one side of the spine than the other. There's lots of different reasons. But either way, that's what happens when you have a slip disc, is it's over time caused damage there, causing the stuff to leak out. So what can you do about it? Well, first of all, in some cases of slip discs, they require surgery, but normally they're the very severe cases. So that's stuff that hasn't responded to any other form of treatment like physio or chiropractic or exercise, for example, or it's causing very, very severe symptoms like numbness all the way down the back of the legs, that kind of thing. Most cases resolve very well through manual therapy, so through conservative care, things like chiropractic. And the key is to get the mechanics, get the movement of these discs in these joints working better. Because if you normalize the pressure on the disc, meaning you get it working properly and you align the spine correctly so the pressure's on the right parts, then that disc matter can actually get sucked back in. So it can heal, but it can take months or up to a year, sometimes even longer for that to happen. So during that process, you still got to look after it so you don't keep aggravating it, especially when it stops hurting and you kind of forget to look after it. But there is hope, because most of the time these things can resolve, but like I say, you've got to look after it and you've got to address the reason why it happened in the first place. So that's a slip disc. If you've got any questions about that, let us know. And I'll see you soon. Take care.